everyone, and hope you're all having an amazing day or had an amazing day depending on your current time zone. So today is a very special video. I actually had an opportunity to interview two very amazing ladies, Dr. Trisha Larkin and RN Miss Leslie Mellin. Both of these ladies are a part of the Oncology Hematology Pediatric Department located at St. Joseph's Hospital or St. Joseph's Children's Hospital in Tampa, Florida. They actually gave me the opportunity to interview them and ask them a little bit more about TSC or Tuberous Sclerosis Complex and its effects on my daughter, not only my daughter, but obviously other children that have TSC. So I put together 10 questions and then asked them if they'd be willing to come on my YouTube channel and do a little interview with me, and they said yes. I wanted to formally introduce both of them because I didn't really get a chance to during our interview because I know they have rather very busy schedules. So let me just kind of give you a rundown of their background. So with Leslie, again, she is a BSN, RN, and CPN. She's a part of the Neuro-Oncology Pediatrics Department at St. Joseph's Hospital. She's a Neuro-Oncology Nurse and Coordinator, and she is really involved in the Pediatrics Hematology and Oncology Department there. She is my go-to for any questions, any concerns, especially for, whether it's just where to go to for my daughter's blood work, or she sets up my daughter's CTs and MRIs. She's always like extremely responsive, gets back to me right away, and I wouldn't want it any other way. She is phenomenal. And now we've been going there. We originally started seeing Dr. Cockrell, which is also a phenomenal doctor there. And we now see Dr. Trisha Larkin. She's been a major or very critical part in getting my daughter to a point where she's actually feeling a lot better. We had some ups and downs as far as my daughter's medical history is concerned. As you've seen in prior videos, she's just has so many issues, and it's a balancing act, right? Because we have to keep my daughter's kidneys healthy as well as make sure that SAGA in her brain doesn't grow to a point where it can be detrimental to her health overall. So Dr. Trisha Larkin, she's the Director of Pediatric Neuro-Oncology at St. Joseph's Hospital. She is dual board certified in pediatrics and pediatric hematology oncology. Dr. Larkin earned her medical degree from Florida International University College of Medicine, followed by her Master's of Business Administration. She completed her postdoctoral training at Nicholas Children's Hospital and at the University of Florida Shands Children's Hospital, where she completed a fellowship in pediatric hematology oncology. She also went to complete a prestigious advanced fellowship in neuro-oncology at St. Jude Children's Research Hospital in Tennessee. While at St. Jude, she worked on a team of world-renowned physicians to care for children diagnosed with complex brain and spinal tumors, which makes her detrimental in this whole process for my daughter, especially, or my youngest daughter, Alani. It's so important to have the right doctors out there fighting for you and making sure that your child has the best care possible. Hello. For those of you guys that are new to my channel, welcome. For those of you guys that are seasoned subscribers, welcome back. On Mondays, I do videos all about fashion, accessories, just fun things that I enjoy doing to keep my mind off of the second half of the week videos, which are all about my girls and their battles with TSC and FSGS. TSC being Tuberous Sclerosis Complex, which is tumors that can grow in any major organ throughout your body, or FSGS being a form of kidney disease, which causes damage to the glomeruli, which is the kidney filtration that can lead to kidney disease, kidney failure, dialysis, or transplant depending on the progression of the disease. So if you're interested in either or, please hit the subscribe button and hit the little bell so you can be notified on all of my latest videos. And please don't forget to hit the like and comment below. Let me know what you think of today's video. So, Dr. Larkin, what are the common signs and symptoms of TSC, and what should I watch out for when it comes to my daughter?
Absolutely. So one of the very first things to know about TSC is a lot of the kids will present in infancy with seizures. Seizures are, by and large, the most common presentation that we'll see with our kids who have TSC. These seizures can be infantile spasms, so presenting very early on in life, usually in the first 3 months or so, with just refractory seizure activity. If you're seeing anything abnormal like that, it's very important to raise that concern to your pediatrician. Other common things that we see early on are the skin abnormalities that you would see with TSC.
Definitely.
So very typical to have for these patients to have little hypopigmented spots, Facial angiofibromas, which are little benign growths on the face, typically kind of in the butterfly distribution, so around the nose and cheeks, and something called Sjogren patches, which are kind of like just these little patches on the skin. Things that you don't necessarily see right away with TSC and that are very important to be aware of are things that we take care of in our office. So as a neuro-oncologist, patients with TSC are at risk for benign tumors of the brain that are called subependymal giant cell astrocytomas, or SEGA for short. Patients can also develop other benign lesions throughout the body. So they can develop things called angiomyolipomas in the kidneys and kidney cysts. They can develop rhabdomyomas in the heart, which are benign tumors in the heart. They are actually typically present at birth, and usually are not necessarily detected unless someone hears a murmur or baby has an abnormality of the heart that they're picking up on. Later on in life, these patients are at risk for developing different types of developmental delays, behavioral and psychiatric issues like ADHD and anxiety, and girls specifically with TSC, as they get older, they're at risk for something called LAM, which is related to the pulmonary system.
Okay, guys, so let's introduce our second guest here. This is Leslie Mellin. She is a BSN, RN, and CPN Neuro-Oncology Nurse Coordinator here at St. Joseph's Hospital. Both of these ladies are very phenomenal. If you ever have an opportunity to visit St. Joseph's Hospital, this is the Pediatric Oncology, Hematology, right?
Oncology, yeah.
Oncology, Hematology Department for Pediatrics. So if you ever have any questions or you want to know a little bit more about TSC, these are the ladies here that you need to hook up with. Okay, so let's get to the second question. Dr. Larkin and Leslie, hey, if you have some information to add, what kind of regular screenings or tests should my daughter undergo to monitor TSC?
So from the neuro-oncology standpoint especially, brain MRIs are really important. For patients who have not been discovered to have these SEGAs, we do recommend brain MRIs with and without contrast about every 1 to 3 years to monitor for the development of them. Once patients have them, of course, and they're on treatment, we usually monitor closer, so usually about every 3 to 4 months with scans to kind of check their progress and slowly space those out. We mentioned, of course, that patients with TSC have seizures, so EEGs at the discretion of your neurologist are very, very important. Kidney ultrasounds or MRIs to assess for those kidney lesions and cysts about every 1 to 3 years. Echocardiogram in infancy, definitely, and then as clinically indicated based on the presence of those rhabdomyomas. Lung function tests, especially for females and especially in adolescents, because that LAM is something that patients are at risk for as they get older. Developmental and behavioral assessments, specifically with neuropsychology if available at your center, and then eye and skin exams.
Awesome. Thank you so much. Anything for you, Leslie? Are you good?
The pediatrician, and then when Dr. Larkin tells me all the stuff that needs to be ordered, I will help the magical coordination so it's not all on the parents.
Definitely. And Leslie's definitely one of the most amazing coordinators I've ever worked with, by the way. I appreciate your support, seriously, because I'm chaotic. She's definitely helped me out. All right, guys. All right, so are there specific specialists or healthcare providers, like neurologists, cardiologists, that we should regularly see?
So we definitely recommend seeing neurology because seizures are going to be, by and large, probably the most great concern for a lot of families with TSC. Nephrology is usually recommended for kidney monitoring, cardiology for the heart, neuro-oncology if your child does happen to have a SEGA associated with their TSC, dermatology, pulmonology for any lung involvement, especially again as they get older. If you have a developmental pediatrician in your area, that's wonderful, but a lot of the pediatricians also in the community are very well versed with this. Here at St. Joe's, we have something called a complex care clinic, which we stole Leslie from, but they provide a lot of the primary care for our patients with TSC. And then genetics, of course, for initial genetic counseling and then for family planning as kids get older.
Definitely. Thank you so much. I appreciate that information. I think that's really valuable, actually. So what would you say would be the best way to manage seizures related to TSC, and are there treatments available to reduce or prevent them?
So first-line medications, of course, are going to be our traditional anti-epileptics. Specifically for infantile spasms, there's a medication called vigabatrin, which I will defer the neurologist to talk to you guys more about. But that was definitely a landmark medication in the world of neurology when it first came out for patients with infantile spasms. For growths, And specifically for the brain tumors, we have a class of medication called mTOR inhibitors, so drugs like everolimus and sirolimus that help reduce TSC-related growth by actually stopping the pathway that causes these growths to develop. I remember kind of the very early infancy of everolimus and some of the very early clinical trials in my time as a neuro-oncologist. And when this medication came out, everyone in the neuro-oncology world was so excited about it. And what we know is about 85 to 87% of patients who have those SAGAs actually respond to the medication really nicely, and we can help limit the need for surgeries and things like that with these medications. There's newer data coming out that these medications also can help reduce seizure frequency in patients with TSC. So, as we continue to learn and as we continue to study these patterns, we'll, definitely hopefully expand this repertoire of medications. Some patients really believe in the data and research that's coming out about ketogenic diets. I would defer again to neurology and and dietitian to really talk to you about that, but there are some really good papers out there for ketogenic diets now, specifically for patients with refractory seizures. Those things unfortunately are not shown to help the tumors as much from a research database yet, but again, we're always learning. And then epilepsy surgery or vagus nerve stimulation in centers that have, really trained and dedicated pediatric neurosurgery could be used as well if seizures are medication resistant.
Would you say, or can TSC, or I guess just a little bit more about that, can TSC lead to developmental delays or intellectual disabilities, and are there therapies or support services that can help? And I know you discussed that a little bit before.
Absolutely. So we do know that there's a correlation between patients who have TSC and developmental delays and behavioral issues. So some of the things that we recommend, of course, are early intervention. I think it's very important that pediatricians recognize the signs and symptoms of TSC early on and get patients referred to speech, occupational, and physical therapy very early on as well. What we know is early intervention is sometimes best for maintaining and really achieving great milestones. Behavioral therapy, specifically for patients who have ASD or autism spectrum, ADHD, developmental pediatricians are wonderful in helping guide some of those recommendations. And then there is kind of social skills training and family counseling and those types of resources available at some centers as well.
So thank you. It's definitely helped my daughter as well, by the way, guys. So it's really important that you take advantage of those more than I can explain. All right. So what would you say are the risks for kidney or heart problems, and how can we prevent or address them?
So, the biggest issues, I think, with kidney and heart issues specifically, are kidney and angiomyomas can cause bleeding and kidney dysfunction. So it's really important that these things are being monitored very, very closely with imaging and with the help of our community nephrologists. Sometimes these things can be treated with the mTOR inhibitor, so the drugs like everolimus, or embolization if needed, and typically we would defer the nephrologist to manage those recommendations. The heart rhabdomyomas actually are interesting because they can regress over time, but they do need monitoring very early, especially in infancy if they're large in size. And then blood pressure monitoring is also very important to help prevent complications that, of course, can come from hypertension.
And just note, you can get those items actually. We have blood pressure tools all over our house. We have about 4 of them. You can get them right off of any online store. So don't hesitate to purchase one. I would highly recommend one, especially if you have a child with TSC. Yeah, especially with the high blood pressure issues that we have in our family, as you're well aware, right?
And from a blood pressure monitoring standpoint, Leslie can, as a nurse, can talk to the importance of how important it is to make sure those cuffs are adequately sized for kids.
Yes, as I say, movement, too big of a cuff, too small of a cuff will give you false results. So you do want to make sure that you actually know what you're doing and then know what the standard blood pressure parameters are. And then if you need teach and training, that's the type of thing that your nurse would be more than willing to do.
Exactly. Yeah, I had to get training from ours, so definitely, I agree. I actually took a 20-minute training.
Yes, it's very valuable.
All right, so I guess for both of you guys, what are the lifestyle or dietary changes that can help manage the symptoms of TSC or improve overall health, right? Because we've discussed this before too.
Of course, recommending a well-balanced diet, possibly low in carbohydrates if you talk to your neurologist and they do recommend any type of ketogenic plan for seizure management. For all patients, but especially for patients with TSC, because of that risk of pulmonary complications as they get older, making sure that we avoid any type of smoking. Vaping, especially in our teens, has become very popular, and vaping can cause a lot of pulmonary injury that the pulmonologists are just starting to learn how to fully understand. In females, we actually also recommend trying to avoid estrogen-containing compounds and estrogen-containing medications because LAM, which is that kind of benign tumor that we know can occur in patients with TSC and lung nodules as they get older, it can actually be driven by estrogen. So we recommend avoiding estrogen. So as your teenage girls are getting older, if they're having menstrual complications, you really want to be looking at more progesterone-based options for them. And then, of course, regular exercise for overall health. One of the side effects of everolimus is that it can increase your cholesterol. So we always recommend kind of making sure that we maintain healthy diet for that reason as well, to help counteract some of the side effects of the medication.
Definitely. That's probably the hardest thing that I had to deal with my youngest daughter, excuse me. That was difficult. But I got her to like fish at least,
Yeah, see?
Okay, so would you say, is there any new research or clinical trials focused on TSC treatments that might be available to us today?
Sure. So for TSC, a lot of the research that's out there right now for the world of pediatrics is really related to seizure management. So there's one kind of huge trial going on right now that's called the TSC STEPS trial. And basically this study is looking at determining if early administration of a medication called sirolimus, which is an mTOR inhibitor, can help prevent seizures and epilepsy in infants that are diagnosed with TSC. In order to be eligible for the study, you actually have to be under 6 months of age. So they're really looking at the babies. And there's more information about this study available on the clinicaltrials.gov website. There's also some kind of biorepository, national history databases, and some more survey-based studies that are looking at trying to understand and address behavioral problems related to TSC. So one of the big ones currently for our pediatric patients aged 3 to 6 years old is something called the Rainbow Study, and it's fully remote. It relies on families just kind of filling out internet-based parent-child interaction type surveys to really help try to understand the behaviors that can develop in kids specifically with this age. There are, I believe, 2 other studies looking at anticonvulsant medications for TSC, but again, I would defer those questions to your neurologist.
Sounds good. Appreciate that. All right. So what would you say are the long-term health implications of TSC as my daughter grows older, as our children grow older with TSC, and how should her care plan change over time?
So, the biggest thing that should happen is that patients should really be monitored for some of the tumors and complications that these patients can develop. So the TSC Alliance is sort of our big national group that puts together surveillance recommendations for physicians taking care of patients with TSC. Usually they update their guidelines every few years, and that's where I would go to as your main site. That's what we use here to create roadmaps for our patients.
And we'll link that below so that way you guys have it as well.
The other kind of really important thing to know is that the risk of developing benign tumors actually increases with age. So, as a pediatric office, we're kind of talking about the things that can affect the kids. But as they get older, making sure that we're really staying on board with doing that tumor monitoring and transitioning to adult providers who are also aware of the complications that can happen with TSC are very important.
Awesome. Thank you so much. So last but not least, let's ask, how can we create a support network for both my child and other people's families, right, and our family as we manage TSC?
So as I mentioned, the TSC Alliance is sort of the big national group, an international group actually, for connecting families and patients to resources with TSC. So, follow the link there. And then really joining online and local support groups, trying to learn as much as you possibly can, and then working really closely with your medical providers and your therapists and your educators. So the schools and teachers are really important in helping make sure that these kids achieve their full potential.
Awesome. Thank you so much. So is there anything else that you think our TSC family out there or families out there should know about TSC and, and how can we make sure that they are well informed, right? Because when I first had my daughter, I guess I can add this one little thing here. when I first had my daughter, there weren't really a lot of doctors that were familiar with TSC. I actually found out by taking my oldest daughter to a pediatrist, and he indicated, he looked up in a book and saw that what she had on her toenail was a periungual fibroma, and that's how I ended up finding out. So it was kind of like a full, like one day everything's normal, the next day everything, our house is falling. So how do you, what would you recommend for just to keep families informed or help them be more knowledgeable about the actual disease itself?
I think first and foremost is if you have any concerning skin lesions on your child, definitely bringing those to the pediatrician's attention, because sometimes that's the very first indicator that a patient can have some of what we call these neurocutaneous syndromes, so things like TSC, but also things like neurofibromatosis. And then trying to connect yourself with a center that really does a lot of coordination of care, because it is very, very important to have all of your medical providers sort of be in communication, sharing records, sharing scans, things like that, for patients so that, you know, you really do get that comprehensive care that's required for TSC monitoring.
Awesome. Thank you so much. I appreciate it. Anything else that you want to add? Or either you guys?
No, I just sat here and visiting my favorite person, I would say. But having a good neuro-oncologist who knows everything from the top to the bottom is, I think, paramount. And then a good neurologist. Definitely. I think they're the key components of TSC.
Yeah, that's really huge out there, guys. So the first thing you definitely want to do is find someone that you can work with and find the right doctors that not only are great doctors, but also fit your, I guess, fit your way of being, right? Because we don't always fit with the doctors. I've gone through it, but definitely recommend visiting Dr. Larkin and Leslie out here in St. Joseph's Hospital. If you do need a pediatric oncologist, hematologist, obviously we don't want people coming out here for no reason. So definitely, I would definitely recommend their services. They've been such a huge, a pivotal part in our road to recovery. Because obviously TSC, it's not curable, right? As you're well aware, all we can do is really treat the symptoms, right? So we're just trying to get our message out there, make sure that you guys are informed of what's going on and what we can do, whatever we can do to provide you with the information so that you're more knowledgeable about TSC. So again, thank you, ladies. I appreciate your time, and please, guys, don't forget to focus through and evolve. Ciao.